Hello there. My name is Dr. Calliope. I'm going to be taking care of you today. How are you doing today? Okay. I hope by the time you leave this appointment, you feel even just the littlest bit better. You'll give me just a moment. I'd like to ask you some questions. Let's see. Excellent. So, would you mind just confirming your name and date of birth for me? Excellent. And is that your preferred name? And how do you like to be addressed? Excellent. So I'd like to ask you a few medical history questions, if you don't mind. Okay. First, is there any particular reason why you wanted this examination today? Very good. And any current pain or illness at all? Excellent. And any changes to the medical history that we have on file? And any changes to the family history that we have on file? Good to hear. Any changes to your allergies at all? Okay. And what about your medication list? Is that up to date? Excellent. Very good. So today we are going to be conducting a face, head, and neck examination, although not necessarily in that order, okay? So what I'm going to be looking at is I'm going to be both inspecting and palpating your head, your skin, your hair. I like to take a systematic approach to looking at the eyes, nose, mouth, and ears. And then we're also going to be taking a look at your neck, at your lymph nodes, and your range of movement, to just name a few things. Okay? Any questions so far? Excellent. So if at any point you feel any pain or any discomfort at all, please just let me know, okay? And from this point onwards, I will need to be touching you. Is that okay with you? Do I have your permission to do that? Wonderful. Thank you. So to start, I want to do a general inspection of the head, of the face, and of the neck. While we're here, I do also just like to have a look at everything else, just a cursory exam, make sure there isn't anything overt, okay? So I'm just going to sit back a little bit, and I like to look at the head, make sure that it is well proportioned to your body, that your features are reasonably symmetrical, that one side isn't larger or smaller than the other, that there isn't any drooping on one side, that you're not holding yourself in an odd position, that everything looks, for the most part, reasonably normal. Okay? Good. Now I'm going to get up very close, and I like to take a look at the skin. So I like to look at the quality of the skin as well as the pallor, if it's the correct pallor for you, that there's not any sort of redness or paleness or any off coloring in the skin. That the skin looks healthy. Just feeling the quality of the skin. Just feeling the temperature of the skin. Even on the neck here. Just making sure that your skin is warm to the touch and that there isn't anything off about its texture. Okay, I'm going to feel your hair as well. So oddly enough, your skin, your nails, and your hair are where a lot of problems may show up that are happening somewhere else in the body. Okay, so the hair is definitely soft. It's not brittle at all. Looks good. Okay, just give me a moment. So now I'd like to palpate your scalp, okay? You let me know if there's any pain or tenderness, okay? I like to start here at the hairline, and we're looking for any signs of lumps or bumps, infections, infestations, skin breakdown, lesions, all sorts of things. And around the hairline is often where one can find quite a few things, should there be something present. Okay, just feeling along the side, down the nape here. Any pain or tenderness in this? No? Okay. Very good. All right. Okay, so now we're going to do a little bit of palpation on the face. Now first, I'm going to be palpating your sinus cavities. Now you let me know if there's any pain in any of this, okay? So I'm going to start with the frontal sinuses here, okay? So again, just let me know if this is painful at all. No? Do you often have issues with your sinuses at all? No, not so much. That's good. That's good. Okay. I'm just going to very gently tap, 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 tap. Go along there. Nothing there? No problems? Okay. And with both hands, tap, 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 tap. Nothing there? Good. Okay, now I'm going to come into the nose and we'll move along the maxillary sinuses. Okay. I'm just going to press my thumbs in here. Any pain or tenderness in this? Okay. And if I tap, 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 do any sort of tapping? No? And if I do it bilaterally? No. Okay. Let's feel along the maxillary sinuses then. Any pain? No? Okay. If I do tap, 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 tap. Any pain here? No? And if I do that bilaterally? No. Okay, very good. So now I'm going to be feeling around your temporomandibular joint right here. We're also going to be feeling the temporalis muscle a bit as well. I'm going to have you follow some simple instructions, okay? So I'm just going to feel around here first, and you just relax, and I'll tell you what to do when I need you to do it, okay? Do you have any problem with TMJ pain? Any teeth grinding, any clicking, or any problems with the range of movement? Okay. Very good. All right, if you could clench your jaw for me. Good, and release. Clench your jaw. Release. Clench your jaw. And release. Good. Now can you open your mouth for me? Close. Open. Close. Open. Close. Okay, very good. Now I'm going to do that same kind of deal right here on the temporalis muscle. Just feeling around a bit. Do you often get headaches in this area at all? No? Okay. If you could clench your jaw for me. And release. Clench. Release. Clench. Release. Okay, if you can open your jaw. Close. Open. Close. Open. Close. Okay, excellent. Let's see here. Okay, excellent. So now we're going to be working with your eyes first before we move on to your nose, your mouth, your ears, etc., etc. Okay? So first I'm going to get really close to you, and I want to have a little look at your eyes. Okay, just taking a little look at your eyes here. So the brows are intact, as well as the eyelashes, good distribution, and the skin around the eyes is clear. The tear ducts are nice and pink and moist, and the sclera is a good white color. Your irises are clear. There's a clear distinction between the pupil and the iris. Pupils are reacting to me coming in and out. That's good. I want to take a look at the conjunctiva. So I'm going to pull your eyes up. I want you to look down. Okay? I'm going to pull up. You look down. Okay, the tissues are pink there. They're not pale, they're not okay? And I'm going to pull your eyelids down. I want you to look up. Just pull down and look up for me. Good, 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 good. Okay. That looks good. I quite like the look of how your eyes and their tissues look, so that's good. Now I'm just going to really quick cover one of your eyes and look at it, and cover the other eye and look at it, okay? So I'm just going to cover this eye, look at the other eye. Sometimes some people can get a little funny defect where when you cover one eye, the other eye does some goofy things. I'll just cover the other eye and just watch this eye. Just watch for any sort of odd reaction. Okay, very good. Now I'm going to take a pen light right here, and it'll be a little bright, okay? I'm just going to make sure that your eyes are reactive to the light. I'm just going to be shining the light into your eyes. You don't have to look into it. In fact, if you'd like, you can look at the wall behind me, okay? I'm just going to come in pretty close, and I'm just going to bring the light in. Good, 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 good. And I'm just going to look at the other light here, or the other eye rather. Good. Okay, so your eyes are reactive to the light. You go around, reactive to the light. Very good. Excellent. While I'm here, I'm just going to real quick do what's known as the swinging light test, okay? It's very simple. Just going to be shining the light in your eye, swinging it to the other side, swinging it to the other side, swinging, swinging, and swinging. Very good. That looks good. Need just a moment. Okay, so now we are going to be testing your cranial nerve number 2, and the way we do this is with a Snellen chart. Now, unfortunately in this office, I don't really have a good place to put our Snellen chart. We're just going to have to improvise. So I'm going to sit back a little bit, and I'm just going to have you read the letters on this chart. I imagine you have done this sort of test before. So I'm just going to be using my pen light here as a little guide. So if you could just read this letter for me. Good. This one. Good. Here. Excellent. Here. Yes. Good. Okay. And let's work backwards. Here. Here. Good. Good. Here. Good. 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 Here. Good. Good. Yep. Perfect. Right here. Good. Good. Yep. Mm-hmm. Good. Good. Right here. Mm-hmm. Good. Good. Yep. Mm-hmm. Good. 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 And last one. This one might be a little difficult. We're going to do this line backwards. Okay? Right here. Mm-hmm. Good. Good. Mm-hmm. Good. 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 Perfect. So, visual acuity is intact, so I don't believe there are any problems with your optic nerve. Now we're going to be doing some tests that are testing your cranial nerves 3, 4, and 6. Okay? So first we're going to do the accommodation reflex. All right? So I want you to just take a look at this pen light right here. Okay? Just the tip of it. And I am going to have you follow this pen right here without moving your head, only moving your eyes, okay? Only moving your eyes without moving your head. All right, so if you could just keep following this in and out. Good. In, out. Good. In, out, in, out, in. Very good. Okay, so now we're going to do what's known as the H test, and this tests your ocular movements, so part of our cranial nerves. I'm going to have you look at this light, and just like our accommodation reflex test, I want you to follow the light using only your eyes without moving your head, just as best as you can, okay? All right, so just follow the light. Follow the light as best as you can. Good, 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 good. Mm-hmm. Excellent. Just keep following the light. Just keep following the light. Very good. Okay. Up, down, back neutral. Okay, we're going to go diagonally up, diagonally down, diagonally down, diagonally up, diagonally up, diagonally down, diagonally down, diagonally up. Very good. Now we're going to test your peripheral fields. So I'm going to have you cover this eye for me, all right? And I'm going to cover the same, so it's the same side here. And I'm going to bring my fingers in. And I just want you to tell me when you see them come into view. Okay? All right. So. Good. 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 Mm-hmm. Good. Good. We're going to switch sides. So I'll go ahead and cover this eye for me. Good. Just let me know when you see my fingers come into view. Good. 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 Excellent. You can go ahead and take your hand off your eye. So the last test that we have for your eyes is what's known as a fundoscopy. And this is where we employ the use of our ophthalmoscope. I'm just going to be twisting this in. Okay. The light. Okay. All right. So what I'm going to be doing is I am using my hand on top of your head to steady myself so I don't run into you, okay? And I'm just going to be looking for what's known as a red light reflex. And then I'm going to be using this tool to look in the back of your eye. Look at your optic disc. I'm going to look at all the little blood vessels, okay? All right, so put my hand on top of your head here, okay? And I'm just going to be first looking for the red light reflex, okay? And then I'm just going to be coming in very close and looking at the eye, the back of the eye. Very good. So blood vessels look good. Good. Right. Okay. I'm just gonna come back. I'm gonna look on the other side. I'm gonna put my hand on your head. Look for the red light reflex. And then I'm just going to be coming in really close so that I can look at the health of the eye. Very good. All right. Okay. So, real quick, real easy. Put that down for now. Now, I'm just going to note that down, and then we're going to take a look at your nose. Okay, so I'm going to need my otoscope and a speculum for this. I'm going to switch the heads on my multi-tool here. So I'm going to be using the otoscope to look inside of the nose. I'm going to look at the tissues way up in there. Make sure that they look healthy, okay? I'm going to have you tip your head back for me, okay? And this is not going to go inside of your nose. It may just go right here, but I just want you to be aware of that, okay? So if you could just, keep your head back. Okay, so no signs of any perforation in the septum, no signs of deviation septum on the side. Tissues look pink and moist. Okay, I'm just going to switch to the other side. Alright. Very good. Okay, so no perforation. The septum looks to be intact and healthy, and the flesh. Okay. Alright, very good. So, just going to take off that speculum. And I'm going to feel a little bit around your nose, okay? Is there any pain in this at all? No? Nothing on the nares? Very good, okay. You ever have any problems with your sense of smell or any problems with breathing in through your nose? Okay, very good. So we're going to test cranial nerve number 1 with a little smell test. okay? So I want you to close your eyes for me, and I'm going to hold something under your nose. I want you to tell me what you smell. What's that smell like? Lemon. Very good. Excellent. So that takes care of your nose. If you'll give me just a moment. Okay. Now I want to take a little look at your mouth, okay? So your lips look pink and healthy. I'm not seeing any paleness in them. There's no blue tone to them. If you could open your mouth for me. The corners of the mouth look good, right? Just taking a look at the oral mucosa. And if I can look a little bit at the hard palate. Very good. And can you lift your tongue to the roof of your mouth for me? Okay, very good. All right, and you can put that down. There's no signs of any cavities at all. Okay, give me just a moment and we'll look at your throat. Okay, if you could open your mouth again. Yep, I'm just going to put this on your tongue. So the throat looks good. I'm not seeing any tonsilary swelling. I'm not seeing any redness. Okay, your uvula is midline. If you could say ah for me. Very good. Okay. All right, excellent. And we're going to test your hypoglossal nerve real quick. Guides your tongue movement. So if you could stick your tongue out for me. And can you move it to the side? The other side. Up and down. Excellent. Very good. Just a moment. Okay, so for cranial nerves 9 and 10, we're going to do a little swallow test here. So I have a bottle of water here, and I have a little cup, and I am going to have you drink some of this water. Okay. Go. All right, so a little bit of, it's rather cool, it'll probably be nice. If you could take a sip of this for me. Yep, you can drink the whole thing if you want. Okay, and swallow for me. Very good. All right, that looks great. And your voice has been clear. There hasn't been any hoarseness in it. That's good. Now we're going to be taking a look at your ears. Just going to take a moment to pop a new speculum on our otoscope. So I'm going to look at the ears and then I'm going to do a little bit of palpation, okay? So I'm just going to take a little look at the ear and just make sure there isn't any sign of lesions, swelling, redness, infection, that sort of thing. Okay. And the other side here. Very good. And if I just look at the back here. Back of the ear. Okay, very good. And here. Just looking at the back of the ear. Okay. I'm going to do some palpation. You let me know if there's any pain or any discomfort, okay? pain or discomfort? Okay, so now we're going to take a look inside of the ear. Flip on my little light, and I'm just going to be pulling your ear up and back so I can straighten out the ear canal. We're going to be taking a look inside. I'm just going to be pulling up and back and just placing the otoscope into the ear canal. So, making sure that I can see the tympanic membrane, that it is a pearly gray color, that the tympanic membrane is intact. I can see the cone of light as well as the tip of the malleus through the tympanic membrane. Okay, that there isn't any impaction of cerumen, that there isn't any sign of infection or fluid in the ear. Okay, I'm just going to pull the otoscope out, and I'm going to do that to the other side. Pull up and back, and then take a little look inside the ear. So again, the external auditory medius is clear. There's no impaction. That there is no perforation on the tympanic membrane, no signs of infection, fluid buildup. You can see the tip of the malleus. Okay, very good. I'm just going to pull that out. Excellent. So that looked great. I'm going to be testing your hearing a little bit. This is your acoustic cranial nerve. Okay. So I'm just going to be whispering some words into your ears, and I want you to tell me what those words are, okay? All right. Flower. Face. Painting. Handle. Bag. Okay, very good. I'll do that to the other side. Doorknob. Pocket. Picture. Book cover. Can. Okay, those are all good too. Excellent. So after this, we'll be moving on to your trigeminal nerve. Okay, and your trigeminal nerve governs your facial sensation. So we're going to be doing a test called the soft, sharp test. What I'm going to be doing is I'll have you close your eyes, and you're just going to tell me whether you feel a soft touch or a sharp touch, okay? So I'm just going to run these along your jaw so you know what each feels like, okay? Here's the soft. Okay, and here is the sharp. Yeah, just more of a pinprick sensation. It's not going to hurt you at all. It's not going to break the skin. It's just a little pointed sensation, okay? So if you could close your eyes for me and just let me know whether you feel soft or sharp, okay? Excellent. Soft, sharp, soft, sharp, sharp, soft, 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 sharp, soft, soft, sharp. Excellent. So your trigeminal nerve looks to be intact. Now we test the facial nerve with testing your movement, okay? So I'm going to have you smile real big for me. Good, and puff out your cheeks. Very good. And if you could raise your eyebrows. And if you could frown. Okay, and if you could squeeze your eyes real tight. Okay, I'm going to try to open your eyes. I want you to keep them shut, okay? Very good. And I am going to have you push your tongue into one cheek, like that. I'm going to try to push it in with my fingers, and I want you to resist me, okay? So, push your tongue into your cheek. Okay, very good. And the other side, push your tongue into your cheek and resist my pushing. Okay, very good. That looks great. So facial nerve looks great. And to test the accessory nerve, we're just going to do a little shoulder shrug, okay? So if you could shrug your shoulders for me. Just like that. Okay, now I'm going to put my hands on your shoulders. I want you to shrug against my resistance. Good. And if you could bring them up, I'm going to try to push them down. I want you to resist me. Very good. Okay. So all that's left is your neck. So we're going to be taking a little inspection of it, of course, and then I'm going to be looking at your lymph nodes, starting from the back of your head and ending at the clavicle. And then we're going to listen for some bruits with the stethoscope and test your range of movement. Okay? All right. So if you could just hold still for me, I'm just going to look at the neck, okay? I'm going to look to see if there's any signs of any lumps, any swelling, any lesions. Okay. And I'm just going to feel right here. I'm going to have you swallow. Might be a little uncomfortable, okay? If you could just swallow for me. Very good. I can't feel the thyroid. That's good. Okay, I'm just going to do just a little bit of palpation here, okay? All right, very good. So now I'm going to check your lymph nodes, okay? I'm going to start with the occipital at the back of your head, okay? I'm just going to feel the lymph nodes back here. Right along the hairline, generally. And then the post-auricular nodes, right behind the ears. Pre-auricular nodes, the front of the ears. While I'm here, I look at the parotid gland. Okay, and the tonsillary. Okay, and submandibular. Submental. Okay, and then I'm going to feel the superficial cervical here on the neck, deep cervical chain right here, posterior cervical back here, and the supraclavicular just above the clavicle here. Okay, so there's no distension in any of the nodes. That's good. Okay, now let's test the range of movement of your head. Do you have any problems moving your head or any pain? Okay, no? All right. So I'm just going to have you follow my instructions. If you could look down as far as you can. Okay? And if you could go back as far as you can. Good. And if you could look to your right. And if you could look to your left. Good. And then if you could tilt your head so one ear is touching your shoulder, or at least almost. Good. And the other side. Just tilt your head to the side. Very good. So last test, we're going to auscultate for bruits. Bruits are an audible heart murmur. So what I'm going to have you do, I'm going to have you turn your head to the side for me, okay? And I'm going to place the stethoscope on your carotid artery. And I want you to take a deep breath in and then hold it, okay? Deep breath in and hold. And you can exhale. Good. And other side, if you could turn your head. Okay, take a deep breath in for me. And hold. And exhale. Very good. Okay. So I didn't hear any bruits in the carotid artery. It's very good. So that just about finishes our examination. Very good. You have any questions for me at all? Correct. I didn't find anything out of the ordinary. I think you are fit as a fiddle. Okay. Any other questions? All right. I'm just going to go ahead and sign off. Very good. And that's going to wrap it up for us. Thank you so much for coming to my office for this face, head, and neck examination. I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now.